Good morning. Thank you for being here. I'm New York State Attorney General General Schneiderman, and I'm here today to talk about a report that my office is releasing, spelling out in detail how we help New Yorkers to solve problems with medical bills and health insurance companies through our Health Care Bureau and our Health Care Bureau Helpline. I'm proud to be joined by several of my colleagues in government and advocates for people with health care issues and particularly health insurance issues. Your great Erie County Executive Mark Poloncarz, State Senator Tim Kennedy, Assemblymember Peoples-Stokes, who I note is the only one in addition to me who got the memo about Breast Cancer Awareness Month. We're also joined by representatives from advocacy organizations that help consumers, particularly in the area of medical debt, which I'm going to speak about. Joe Kellerman from the Western New York Law Center, and Karen Nicholson from Legal Services for the Elderly, Disabled, or Disadvantaged of Western New York. I also want to acknowledge the chief of my Health Care Bureau, Lisa Landau, who's here with us. She has put together the team that does this amazing work and that we're going to be talking about. Lisa did a terrific job leading the team, and as I describe it, you'll see how we've been building up to deal with the problems New Yorkers are facing in 2014 with the healthcare system. I've been here before to make sure that all the hardworking men and women of Erie County and all of Western New York know that our office is here for them if they have to deal with issues related to foreclosure or housing through our HOP network and the funding for legal services and housing counseling. I've been here before to make sure that all of the folks in Erie County and Western New York know that our Labor Bureau is here if employers are cheating them out of a fair day's pay for a fair day's work. And I'm happy to be here today to make sure everyone knows that in a challenging time for health care, and as we are about to enter the open enrollment period for Medicare, our office is also here through our Health Care Hotline to help consumers and to help New Yorkers deal with these very, very challenging issues. If you receive a medical bill that you think contains an error, or if your insurance company denies a claim that you know should be covered, help is available, and our number, which is on the report, is 800-428-9071. New Yorkers can feel confident, and this is part of the reason of putting out this report, that calling us is, first of all, secure and also that it is effective. We've provided relief to a large number of New Yorkers, and as detailed in the report, we've actually assisted more than 20,000 New Yorkers in the last 3.5 years who had questions or problems. We've secured more than $12.5 million in restitution and claim payments for individual New Yorkers statewide, and as I will discuss, we've helped tens of thousands more New Yorkers because our healthcare hotline is also a source of information about systemic abuses by companies operating in the healthcare industry. This is a valuable source of trustworthy information. In many cases, we can intervene and solve problems, sometimes saving New Yorkers thousands of dollars or ensuring that care that they urgently need is actually delivered in a timely manner. We also refer patients to other offices and agencies with particular expertise or jurisdiction, and it's been a tremendously successful program, but it's also helped us understand better the really serious problems facing New Yorkers and all Americans in the transition to a new type of healthcare system. The most common problems that callers seem to face are billing errors by healthcare providers, delays in processing insurance claims, which appears to be an epidemic, and improper denials of claims. Now, this is not really surprising because almost everyone has or knows someone who's had these kinds of experiences. You get a medical bill for more than you expected, or something that your insurer was supposed to cover, you get a denial of coverage on, or you're told that you're waiting on hold for someone who never shows up. There are endless menus on some of the phone lines that are made available. If the answer that you get to any question is confusing or unsatisfactory, you can't get through to the people who are supposed to be covering you or providing medical care, we can help. These kinds of situations are incredibly stressful for anyone, but if you're a family with limited means, and you have an emergency, or you're looking at bills that you know you can't afford to pay, it can be terrifying. Medical debt, ladies and gentlemen, is the leading cause of bankruptcy in the United States. This is very important to realize. We've had problems in other areas of debt in the past. I've done a lot of work on debt related to mortgages, but medical debt is now the leading cause of bankruptcy, and more than 3/4 of the people driven to bankruptcy by medical bills actually have health insurance. So there's a big gap between what we believe health insurance does for us and what the delivery of services actually is. We had one case in which a patient was billed more than $200,000 because the insurer improperly denied a claim. Our advocates intervened, and within 3 weeks, that claim was paid, and that patient, who was facing financially ruinous debt, managed to get the money that they were owed. In another case, here in Erie County, a teenager suffered a serious fall, and first responders called an air ambulance to take him to the hospital and told his family this is what has to happen. The health care plan denied the claim, saying air transport was not medically necessary. Now, when you're a parent with a seriously injured child and the first responders decide and tell you that your child needs air transport, you shouldn't have to question whether or not your insurer will consider that to be medically necessary. Our advocates intervened in that case, and as a result, the plan paid the air transport claim of more than $10,000. And as I've noted earlier, October is Breast Cancer Awareness Month, and we've had cases quite a few cases helping breast cancer survivors to get the care they needed. We have one patient who was scheduled for breast reconstruction surgery immediately following a mastectomy, when her insurer, in between these two procedures, rejected the request for an out-of-network referral. Our advocates got involved, argued successfully that the insurance plan didn't have any participating surgeons, so the patient had to go to an out-of-network provider, and we were able to secure an exception for that patient to go out of network and get the treatment that she needed. And as I noted before, the helpline has also been a tremendous source of information to help us identify broader problems that systemically have been harming tens of thousands of New Yorkers. A lot of this relates to this crushing issue of medical debt. We received many complaints about GE's Care Credit medical credit card, including complaints about high-pressure tactics, large upfront charges, and because of those, the people who alerted us through the helpline, we were able to engage, and we reached a settlement that required sweeping new protections for consumers that we are monitoring, and that was very successful and saved many, many people the challenges of trying to get their way out of debt that they can't afford. In another case involving improper denials of claims for mental health and substance abuse treatment, we reached a settlement requiring an independent review of more than 1,500 previously denied claims, and this could result in as much as $31 million being returned to New Yorkers who were wrongfully denied benefits. Those are just a couple of examples of broader enforcement actions that grew out of helpline complaints, and the way the helpline works is really outlined here on this chart. If you hit a wall and your provider, your insurer, is not helping you, then you call us at 800-428-9071. You speak to one of our advocates. They can help you understand your benefits or expenses, explain the appeals process. In some cases, they serve as a mediator. In some cases, they refer it to a lawyer if there's a violation of law. And they also have expertise in understanding if there's another agency or office that has special information. For example, this is very important in the area of Medicare plans, where there are people with information. A lot of time, patients don't know who to get in touch with. We are very cognizant of the fact, and my colleagues in government and I have spoken about this, that with the October 15th open enrollment period for Medicare coming and the November 15th open enrollment of the new state healthcare exchange coming, we have to all be prepared to deal with the challenges that our constituents face in navigating the incredibly challenging geography of America's contemporary healthcare system. So I'm very proud of the work we've done. I'm proud of the hardworking staff that is a great example of effective and efficient government making a real difference to New Yorkers. And now I'd like to introduce a great colleague in government, someone who has to make sure that health care is delivered every day to a lot of people, County Executive Mark Poloncarz.
Thank you. Thank you, General. It's good to be back with you today, especially to talk about a subject matter that the county is intimately involved in, and that's the delivery of health care for the citizens of this community. Erie County government is the primary provider of health and human services for those who do not have health insurance. But what we found out when there was the enrollment period for the Affordable Care Act is we, in some ways, also became a point of contact with the community as to what the Affordable Care Act does, whether you had insurance and whether you needed to get it. If you had insurance and it was being denied, where should people go? It got to such a point that we actually had to put sort of point of entry service individuals on the first floor of the Rath building and man phones to handle the questions and the amount of contact that we receive from the general public. And I think this is exactly the type of tool that's necessary to communicate with our citizens about the services that are available to the public, not only during the enrollment period through Medicare and the Affordable Care Act, but if you are having problems with an insurance company. Erie County is not the one to deal with. The Attorney General's office is the one that has the power to resolve these difficulties and these concerns that you may have. And I think it's very important that the public understands that your government is here to serve you, especially at a time when we know what it's like dealing with the red tape that's an insurance company. They talk about bureaucratic red tape, but it's got nothing compared to the insurance companies and what they will often do and the impact that that can have on someone's life. We know exactly what happens when someone has a medical emergency. The last thing they're thinking about is my insurance company going to cover this? No, the thing they're thinking about is, I need to get this taken care of as soon as possible, whether it's for themselves or whether it's for a family member. And the last thing anybody wants to see afterwards is then the bill that comes from the insurance company saying, we deny this coverage, we deny this service. When we know these services are provided and are necessary, as the Attorney General noted, with the one case of Mercy Flight being denied for what was a needed medical emergency. The people in Erie County should know that the Attorney General's office is here, and I thank them for not only having the helpline, but also coming out and publicizing it, and Ms. Landau and her crew for working very hard on behalf of the citizens of our community. Because as we saw firsthand in Erie County government with the rollout of the Affordable Care Act, there's people out there who have lots of questions about what is going on in the affordable health care industry today, and they don't know where to turn. And this phone number is an easy way for someone to call from home and from anywhere else and get the answers that they need so that they're not scratching their head wondering, what do I do? But the issue's being resolved and they can get on with their life. So I commend the Attorney General's office for taking this proactive role, especially before the next enrollment periods. I'm sure they're going to get a lot more calls going forward from Erie County and Western New York counties because, as we know, there's always questions when it comes to health care. Our goal in government is to ensure that our public has good, high-quality health care and their questions get answered. So congratulations for this program. Thank you.
Thank you. Thank you. Thank you. And now I'd like to introduce another great colleague in government who serves where I used to serve until I was released early, State Senator Tim Kennedy.
Thank you, Attorney General General Schneiderman, not just for coming here back to Buffalo with some more great news, as you always do, but for this tremendous asset that we have for the public. The Health Care Bureau Helpline is just that. It's a way for individuals throughout New York State to turn in the time of need when they have questions and concerns about their health care coverage, what is they have moving forward, and where they've come from and what has already been administered. I know my office has fielded hundreds of calls where we've actually promoted this helpline and allowed for easy access to information that's critical for individuals throughout Western New York and all across the state to make informed decisions about their health care needs and the needs of their families. The Attorney General has taken great pride in working, as he mentioned, a former senator, recognizing that constituent services is still very much a part of his job as a statewide elected official. So to his credit, he has seen that this sort of innovative approach can actively and accurately help individuals that need it the most at a time in times where they may be at very vulnerable points in their lives and in their families' lives. So millions of dollars that's been put into the pockets of New Yorkers, over 20,000 individuals that have been helped literally with this helpline with healthcare needs across New York State. It's a tribute to the Attorney General and the work of his office. So again, Attorney General, thank you very much.
Thank you very much.
All right.
And now, outstanding member of the Assembly and someone who's been a very, very, you don't say old friend, longtime friend, Assemblymember Peoples-Stokes.
Thank you. Thank you, Mr. Attorney General, and thank you so much for coming back to Buffalo, bringing great news for our citizens and for the constituents that I specifically represent in the 141st. I really wish for the day when we don't have to talk about insurance companies providing barriers for people to get access to health care. But we're not there yet. It is something that still has to be dealt with. And it doesn't matter whether you're a student or whether you're employed or whether you're a senior. Access to getting good health care and being able to pay for it is, quite frankly, it's a quality of life that everyone has to have, everyone deserves. And so whenever there are barriers put in your way, you need someone who can help you remove them, and who better than the Attorney General and folks who understand both the bureaucracy of the insurance company, the bureaucracy of healthcare providers, and the needs of the people. It's just perfect. It's a win-win. I'm looking very much forward to putting up this number on my website. My office actually applauds ourselves on a regular basis for the awesome work that we do in constituent services. I have some really great staff people who do great work. This actually only enhances their ability to serve the needs of our people. So I am grateful for the opportunity to add it to our website. And I again thank the Attorney General for coming and doing this work, because it took work to put this report together. And so we need it, the people need it, and I'm grateful for it. Every time this gentleman shows up in our community, there's good news for our constituency. So come again and come again and come again. Thank you.
Thank you. Okay. Thank you. And it is important to understand that at least here in Western New York, we are part of a united, coordinated team, because humane, affordable health care is something that many of us consider to be a right, not a privilege. And if everyone in New York got the payments they were entitled to, this is something that can help families stay afloat. It can help people make it through hard economic times. So keep this in mind. There are people who sometimes are embarrassed to ask for help when they have a problem with a healthcare provider or insurance company. Or in the case of some of these medical credit services, they're actually in the doctor's office and given an application for some sort of credit card or credit vehicle so they can pay for a procedure they have just been told they need. Don't be ashamed. Don't be shy. Everyone has problems with the insurance companies. Everyone has challenges navigating the healthcare system. We are here to help you and to work with our colleagues in local government to make sure that the people of New York get all the health care to which they are entitled and get all of the payments to which they're entitled from their insurers. So thank you all very much, and